Right, I'm with the junior doctors at the moment, and my new friend here. Sorry, what's your name?
I'm Dr. Abhishek Joshi. Just Joshi.
Okay, thank you, Doctor. Now, why are you here today, in a nutshell?
Today we're here to oppose the imposition of what sounds like a fairly dangerous for the NHS contract proposal from the government. We've had a good few months, if not longer, of negotiations which haven't gone anywhere. The government are continuing with their plans, or have continued to try to negotiate for plans for a contract that will reduce the safety of our patients in the National Health Service.
It will directly reduce there, so how will it do that?
We feel that because a lot of the protections for rest and junior doctors' hours are going to go in the current contract, and that means that there's the chance that trusts will overwork junior doctors to the point where they're not able to make decent decisions in much the way that people, I imagine, remember the bad old days.
Yes, I remember those days. So consultants, they're with you, aren't they?
Almost all of the consultants are supporting us. You can see Andrew Dina on Twitter, who has put out support. Over there is the Heart Attack Centre, which is currently being staffed by consultants. That's the reason why we're able to come out and only provide emergency service doctors for the day.
Okay, and I see it's a very cold day, and unlike traditional strikers, you've no brazier to keep you warm.
No, that's right. That's because we've not done this for very long. This is our first strike in living memory. Doctors don't go on strike because it's quite a painful thing for us to have to do.
And how do you feel about having to do that and not turn up today?
It's quite unpleasant, actually. We did a picket outside the hospital to start with. We knew that there were patients in the hospital. We saw ambulances arriving. There was a real feeling that we were doing something that we didn't want to do. It's not in our nature to withdraw services that we love providing, but it is in our nature to protect our patients, and we think that today, even though there's disruption, and we're really sorry about that, we think that the long-term benefits for the health service, if we're able to get a decent agreement for the government and they can stop trying to provide us with, or trying to impose difficult working conditions that are going to reduce the quality of our healthcare, in the long run this is the right thing to do. But today's a really painful day because we are not people who ever anticipated being on strike when we signed up to this job.
Okay, thank you very much, Dr. Joshi. Pleasure to speak to you.
Thanks for having me.